What did we decide where I stand?
Yeah, so I suppose if you want to stand just there, that's great. And look, I'll say a couple of words, I'll say to you pretty much.
Great. Hello, everyone. Hello. If you could please take your seats, that would be wonderful. Our mics are on now, panellists. So all of your microphones are on, just so you know.
So don't say anything embarrassing.
Don't say anything naughty. Yeah, please feel free. There are lots of seats up the front. You can sit over there, sit here, sit around the corner. I'm sure there'll still be more people coming in. Fabulous. All right. Wonderful to be here, and welcome to CPD's first ever policy exchange. And to kick things off, really excited to have Uncle Colin Hunter here, who many of you know is a legendary Wurundjeri elder. If you've ever been to the MCG, you've seen him there. And Uncle Colin, thank you so much for coming and welcoming us to your country.
Yeah, thank you. Look, I want to start by acknowledging that this afternoon we are meeting on the lands of my ancestors, the Wurundjeri people. And I want to take this opportunity to pay my respects to my elders, both past, present and emerging, elders from all nations, but I particularly want to pay my respects to everyone gathered in the room this afternoon. But I always like to acknowledge if there are any Aboriginal or Torres Strait Islander people joining us, I like to acknowledge and pay my respects to them also. Wominjeka, welcome. Wurundjeri Balik, Yuman Kundi Bik. The Wurundjeri people welcome everyone to land today. Wurundjeri no Bunnambor War, Kondi Ning Nak Dubin and Big Bullig Bor Tilligan. The Wurundjeri people want to look after and protect the land as they did long before. Wurundjeri country extends from the inner city of Melbourne. It goes across the mountains of the Great Dividing Range, west to the Werribee River, south to the Mordialloc Creek and east to Mount Borbor. And the Wurundjeri people are part of the Kulin Nation and of the Warrong language group. Hello, my name is Colin Hunter Jr. or Willert, meaning possum. A name given to me by my grandmother as a young boy. I'm a proud and passionate 7th generation Wurundjeri man and a direct descendant of Bibijan, who was Nullingeta or head of the tribe at time at first settlement. And it's through my grandmother, Gumbriar, meaning white dove, or Auntie Tiny, or Nana, she was known to a last mob, that I got Aboriginal culture and heritage in my life today, so for that I say thanks, Nan. My grandmother was one of the last of the Aboriginal people born in the early 1920s, up at Coranderrk Mission in Healesville, before she got pushed up the Barramon River in New South Wales. In Aboriginal culture, a great deal of respect is given to the land, to plants and animals alike. And as always, got my beautiful gum leaves, so I'll leave them on that chair. And if you get an opportunity as you move around this afternoon or this evening, see if you can get a nice one and put in your pocket for the night, please. The significance of that will keep you safe for a long country and give you the accesses to the resources while you're on country. And while you're on Wurundjeri country, you're welcome to the traditional lands and the waterways of the Wurundjeri people. So Wominjeka, welcome. Look, I forgot to acknowledge you mob that are online. So I just want to acknowledge all that mob online too. But yeah, look, I encourage people, if you're from Melbourne, it's not my story, it's a shared story and we need to own it, you know. So I just encourage people, if you don't know that story of Coranderrk, to maybe watch the 3rd episode of The First Australians. It's on Coranderrk and it tells that story, you know, because my grandmother was the last female baby born on the mission before it became a reserve in 1921. So, yeah, we've been lucky enough that, you know, my great-grandmother commissioned Diane Barwick, a Canadian anthropologist, to do our genealogy in the 1950s. So we've known where we're from a long time. So, yeah, enjoy your meeting.
Thank you, Uncle Colin. And CPD, we regularly have our staff retreat up near Coranderrk and have spent a lot of time thinking deeply about what Coranderrk means. Thank you for your welcome. I know that you're super busy. I definitely am going to take a gum leaf. So thank you so much for your warm welcome to your country. Thank you, Colin. Welcome everyone online and in the room. I think everyone's got a seat now, which is great. But this is a really significant event for us and hopefully for our nation as well. This is I want to start off by sort of saying this is a very personal topic for I would say everyone in the room, right? Anyone who's been a child, that's all of you. Anyone who's a parent. Some of the stuff that we're going to be talking about is, it's pretty traumatic. If you do get emotional, if the stuff that we're talking about does sort of trigger you in any way, feel free to do whatever is going to help you the most. If you'd like to leave the room, you should absolutely, obviously do that. And if you want to speak to Ben privately afterwards, I'm sure he'd be up for that. He's an incredible. His story of recovery and healing is incredible. So just wanted to kind of acknowledge that these are heavy topics that we're talking about. So really, I guess the purpose of this policy exchange and the reason that we brought Ben out to Australia is that we wanted to kind of bring people together to exchange ideas on how governments and communities can work differently to help children, to help families, to thrive, and to convince government decision makers that by acting early, working smarter, partnering more closely with families and communities, that we can deliver better outcomes for children, for communities and the economy. And so, at CPD, we really believe that every child deserves a safe, secure and loving childhood, and one that is full of attachment, as Ben will talk about. So we're doing things differently, as I've said, in these materials. This is not a lecture, it's not an oration. We want you guys to be really involved, both online and in the room. So we're going to be doing a lot of things with Slido. First things first, if you go to your phone, there's Wi-Fi, so connect to the one that says one free something or other. It's the one that has lots of words in it. So yeah, that'll help you to ensure you have connectivity. So you'll be able to speak if you're in the room here with microphones. You'll be able to ask questions and put statements in on the Slido, both online and in the room. And as we've said, this is a policy exchange. We really want lots of ideas. We're not going to be able to get to everyone's ideas tonight, but rest assured that CPD will be harnessing and harvesting all of those ideas. So we have, we really want to draw, as I said, on the collective expertise in the room and online. We've got a wonderful panel. I won't go through all of them because you've already seen them. But of course, Ben Perks is the author of Trauma Proof. Here is the book. If you don't have it, go out and buy one. It's an incredible book. As I said, at times it's a very confronting read, but it's incredibly insightful. Ben and I actually met when we were both living and working in New York on the End Violence Against Children campaign, especially when we were working on Syria and Yemen. But Ben's done some incredible things, including coordinating the Back to School campaign that helped to bring 3 million children, including 1 million girls, back into education in Afghanistan. And he's done a range of remarkable things, and his lived experience in overcoming childhood marked by violence, abuse and neglect is, I think, an incredibly optimistic story. Rana Ebrahimi is the National Manager of the Multicultural Youth Advocacy Network in Australia. like Ben, has worked for UN agencies. Rana is an Iranian Australian, and just kind of want to acknowledge the many mixed emotions that you and your family and colleagues must be experiencing at the moment. Ben and I met on Sunday night outside Parliament House, where Iranian Melburnians were literally dancing in the rain with jubilation and waving Israeli and Iranian and Australian flags, and it was just it was a wonderful moment of unity, and long may that moment of unity continue. Professor Sharon Goldfeld is a paediatrician, public health expert specialising in prevention. She's also a member of CPD's Early Childhood Development Council and a long-term collaborator. Has many affiliations at the Royal Children's Hospital and the Murdoch Children's Research Institute. So we're really unfortunate to have everyone here on the panel. Now, I've spoken for way too long. So we are going to start with a poll and get all of you involved. So if you can, I think the easiest way is to take a photo of that. Do people need to go back to get that QR code? Now online you can also do this. So we're starting with a bit of a future casting question here. So in 10 years' time, if Australia really was the best place to be a child and raise a family, which of the following would have been essential? Now we are creating false binaries here because you're only allowed to choose up to 2, or up to 3 maybe, you'll work it out. But so everyone please go in there and vote. You can see that we're talking about here 1 year of paid parental leave, shared between partners, universal access to high quality, affordable early education and care, kindergarten from age 3, maternal and child health care, including home visits, evidence-based parenting programs. So this is just to get an idea of where people are in the room. So has everyone been able to access this page? If you can't, wave your hand. Okay. I wonder if we can, anyway, it seems like most people, I wonder if we actually have the QR code anyway, we might be able to hand it around. Great, it's on the side there, okay. Great. All right, might just give that another sort of 30 seconds and then we'll close the poll. So,
You can't see the bottom.
Yes, what about the bottom one? Can we see the bottom one?
Or no one's voting for it. That'd be a bit sad.
Yeah, it should be.
There we go.
There you go. That's what you'd expect.
Can we toggle it down a little bit so we can get them all onto one stage? There we go. Great. Brilliant. Thank you.
Yeah.
All right. So we can see pretty evenly spread, isn't it? A poor other, but maternal and child health there ahead of paid parental leave with early childhood education at different stages coming in second. So we're going to come back to this at the end of the panel. This is just a bit of a taste to see where people's priorities lie. Now, of course, what's interesting is that none of these operate in isolation, and together they really form a coherent early childhood development system from pregnancy right through to the start of school. So let's see how that goes throughout. So we're going to have 3 segments to today's conversation, or 3 sections. The first around prevention and early intervention, the second around kind of universal early childhood systems, and the third around kind of people and place and community. So we're just going to jump into another little poll here, just so that you're on the edge of your seats, because we don't want you going into audience mode. So there are 4 numbers here. Now, no one on the panel is allowed to give the answer. What percentage of people in Australia have experienced childhood maltreatment? Is it 5%, 13%, 29%, or 62%? So I'll just give you a little bit longer. And those online, please, I hope you're also contributing to this poll. Just give that maybe another 10 seconds. Yeah, all right, we might close the poll there. And I think we're going to show a few other things, and I'm going to hand over to Ben to sort of open up, and he's going to provide the answer, and you'll see the answer. But, you know, Ben, you talk about in Trauma Proof that sort of child maltreatment is the most costly and least discussed public health issue. can you tell us a little bit more about that as you explain these sort of results, the examples of child maltreatment and the results?
So the data is from the child maltreatment survey that some of you will know, that I think is 3 years old in Australia, the first major population level survey. And if we can have the data come up with the answer, 62% of Australians have experienced maltreatment. For most of recent history, we've been talking about child maltreatment in a kind of an Angela's ashes way, as if it's something that affects people in really chaotic homes on the fringes of society. But a lot of child maltreatment is unintentional, unintentionally transmitted across generations. It's on a spectrum of severity. We know it's a risk factor for every child in the moment. It's catastrophic for children in the moment, but it also has a long-term impact. So the greater the severity of the child maltreatment and the consistency, the greater the risk factor for the child in the moment and for the long term. So we see that children, the reason that it's not talked about, we think, is because child maltreatment is so overwhelming for a child, they're unable to process it. So they suppress, and they have chronic, so that creates something called traumatic memory, which means that people struggle to talk about it. Also, one of the things that children do, which is adaptive and in the end maladaptive, is they self-blame for child maltreatment because it gives them agency. If it's something wrong with me, I can convince my mom or my dad to love me or stop hurting me. And these result in a suppression of the conversation about child maltreatment. And the third thing is social stigma. We now know that from research in Germany and Turkey and other places, that people are not open to having a conversation with somebody about trauma because of the stigma, but because the problem's hidden in plain sight, the person that is unwilling to have a conversation about it is highly likely, according to the data, to be a victim themselves, right? So that's what it does to children in the moment. It has an impact on all of the neurobiological developing systems of the child, the cardiovascular system, the immune system, the endocrinological system. And it also has an impact on things like self-esteem, the way the child views themselves and the world. And it's disproportionately influential if it happens early in childhood when children's brains are really beginning to take shape. And then in adolescence, children who've experienced adversity, maltreatment, and trauma are at much greater risk of violence, exploitation, addiction, and that risk carries on throughout life. So if you look at children in juvenile facilities, children that have been groomed or trafficked, recruited by radical groups, and all of those risk factors, 80 to 90% of those children are having what we call 4 or more adverse child experiences, high levels of maltreatment. They have much worse outcomes in terms of non-communicable diseases, in terms of learning, and much less ability to form the type of relationships that heal. And the cost of that for society is about 10 to 11% of GDP, according to the UN Special Representative, the Secretary General on Violence Against Children. That's really depressing, right? But we've also learned something else. The quality of relationship between a parent and the child is foundational to all development, is the greatest protective factor in the life of a child, and something that can be strengthened through public intervention, particularly parenting programs, which came out on top of the list of interventions, and things like parental leave. And we're the first generation in history to know that. So we are the first generation in history with the capability to end child maltreatment.
Thank you, Ben. It's a really powerful message. And I think what stood out for me in Trauma Proof was kind of the normalcy of trauma. And some of these questions or indicators of maltreatment, emotional neglect, your family didn't look out for each other, feel close to each other or support each other, or did a parent often swear at you, insult you, put you down or humiliate you? And that these are happening in most households, right? And it's not a problem out there. And I think you really paint that picture really vividly in the book. So, yeah, we're going to move into kind of prevention, and how can we prevent this, as you say, and childhood trauma, as you've just said, shapes lives, and if we're serious, we really need to start with preventing that trauma. Ben, you've got an incredibly powerful personal story of how you came to believe that prevention is one of the most powerful levers that we have. Can you share a little about your personal story with us?
Yeah, so I had a very standard UN career. I worked a lot on things like demobilising child soldiers, access to school, and a lot on public health campaigns, vaccinations and things like that. And I went through my career, and I found myself at a kind of a senior level at a conference on deinstitutionalisation. And I was with a minister, and we both gave our opening remarks about the human rights perspective on the right to family, you know, in a very templated kind of human rights language way, pedantic way. We went and sat down, the minister and I sat down, and we listened to an expert on attachment come onto the stage. And he started talking about the way that growing up in institutional care or without proper parental care impacts the emotional world of an adult throughout their whole life. And I realized that he was talking about me because I had grown up in state care. But I'd been really buttoned up my whole career, even though I worked for the leading United Nations Children's Agency, right? Because we didn't talk about those kind of things in the organization so much. And so I went out immediately at the coffee break, and I called a friend who I knew was seeing a therapist. And I booked into therapy right away. It was like an epiphany. And I spent a year in therapy, and I started doing a lot of research on the issue as well. And I kind of really feel like I healed a lot. And my world went from black and white to color, right? And I had been avoidant. I was what they describe avoidant attachment in terms of intimate, close relationships. And after healing, I started a relationship. It's like a family. And when I was holding my son in my arms at the maternity hospital in New York, I realized that what had happened to me was unimaginable to myself. And I walked to the ends of the earth to make sure my child is safe and loved. And I realized that I'd broken that cycle. And then I asked myself, going back to my public health perspective from before, if I can heal from this now and break that cycle, can we not break this cycle for every child before it happens? And that's how I got passionate about prevention.
Yeah, it's such a powerful story. Thank you, Ben. And for those, Ben's extremely open and honest about his childhood in the book as well, if you want to read more. Sharon, maybe we can come to you and build off that. I mean, where have you seen preventative investment work well to support the well-being of children and families? You know, what have been the ingredients for success?
Yeah, and thank you for inviting me, and thank you for everyone for coming in the evening to have this conversation, which it's not often that you get to sit in a room of amazing people and talk about prevention, which is usually the least sexy thing people want to talk about. Everybody loves talking about ambulances at the bottom of the cliff. Not everyone really loves talking about fences at the top of the cliff. So I'm assuming you're all people who love fences at the top of the cliff. So thank you for joining us here this evening. So I want to talk about two stories, actually, and there's a lot in the prevention literature. I'm not going to go through it all, but you know, the challenge with prevention, isn't it, that you're kind of building something, kind of it's a now for later, and that's challenging in the policy world. But I want to talk about two things. So one is I want to talk about the success of immunisation in this country as probably the premier exemplar I can give you around prevention. And the reason it's such a premier exemplar, why we had before COVID anyway, some of the highest rates and most complete rates of immunisation, including probably one of the few examples where I could say we have equitable outcomes for our vaccine rates in this country. There's not very many other outcomes, in fact, almost no other outcome I could put on the table around that, but I could for vaccine. And I think that's extraordinary, and kind of you have to sort of say, well, why? How are we able to do that? And I think there's a number of things there that are worth kind of thinking about. The first was there was this kind of moral imperative around children not getting sick and dying. Like that seemed not okay to have children sick and dying when there was a kind of perfectly reasonable way of preventing it. Not curing it, preventing it. The second was, and this was interesting, it was so this was Michael Woolridge, who was the health minister at the time, said we're going to put in place an actual data system that's going to tell us who's immunised and not immunised, which at the time was like mind-blowing that you could do this. But it does go to the power of data. So then we had this system that could tell us who's immunised, who's not. Then the third thing we said was, you know what, maybe we can just get a whole range of people working out how to do this. It doesn't have to be a doctor giving an immunisation. It could be a healthcare worker, it could be an Aboriginal healthcare worker. Let's make sure that we make this equitable and we co-design how we're going to deliver this across the whole country and how we're going to get parents. We used talking to parents as well as regulation. We used a whole range of things. And then suddenly we have these amazing immunisation rates. And I put that up as a kind of story. I know it's kind of, I think the days of kind of silver bullet sort of things that you can just do this one thing and we're going to see these amazing outcomes. I can only really give you immunisation as that example. But it's a good one to remind us that when you kind of get really into system change, when you use data to drive things and have a kind of mind of equity, you can actually substantially change the lives of hundreds of thousands of children. And that's what we did in this country. And children are doing better, living longer, and all those things because of that immunisation. If you want the counterfactual for that, have a look at what's happening in the US, where children are now dying from vaccine-preventable disease, which is just outrageous. And of course, you've been in this field for a long time. The second is a less successful story, but one that feeds straight into the options that you put on the table. So exactly as you said, if we want to do prevention properly, we need to think, you know, from the pregnancy period and how do we support families to support their children. And when you look at 62% of the population saying they've undergone some sort of abuse, remember that's probably an underestimate because the survey was just a survey. Like it wasn't like we went out and found all the right people. It was just a kind of a cross-sectional survey. So you can imagine how much of an underestimate that actually is. And that's pretty mind-blowing when you think about that. And so it's not, I really liked your point, but it's not going to find all the poor people living in destitution and go, they're the people. This is a population-wide issue. And so we've been thinking about then how do you kind of deliver those sort of universal services with some level of being able to scale up? And we call that proportionate universalism. Many of you in the room will be familiar with it. And we sort of talk about, you know, what's for all of the people, all of the time, some of the people, some of the time, and some of the people, all of the time, to be able to kind of deliver it. And we've been thinking about a lot for maternal child health services, particularly in this state. And then we thought, well, if you look at the literature, there was a great article by this guy called Zimmerman sort of said the number one public health intervention that never gets scaled is sustained nurse home visiting. That's kind of like it's got an evidence base, why are we not doing it? So we thought, why don't we do a trial of that?
Can you just repeat what that was? I didn't quite get it.
Oh, sorry. Sustained nurse home visiting. So that's a nurse engaging with a pregnant woman, and that bit's important because it's all about relationships, and you all know that. And then building a relationship and then having a number of visits with her and her family, and it's actually about empowering that generally woman, I have to say, empowering that woman to be the parent that she wants to be, because nobody gets up in the morning to go, I want to be a really crappy parent today. Like many of us are crappy parents, but we didn't get up in the morning to say that's what we want to be. And so it is really, I can talk later about some of this stuff, but it's really kind of about Maslow's hierarchy, which is how do you give people the sense of themselves being a person and being empowered to be the parent they want to be, what are the skills they need, and building them up. And just a shout out to, actually, I think Anna Price is in the room because she helped me lead this. So we did this sustained nurse home visiting randomised control trial, you know, and you all know randomised control trials, gold standard, bloody hard to do. Anyway, we did it, blow me down, we did it. And then bigger blow me down, because I've done a lot of trials that have had null effect. Great trials, null effect. Blow me down, we got an impact. And we got an impact, there was a difference between the control and intervention group in the children's outcomes around their bonding with and interactions with their parents. the learning environment, home learning environment, and their kind of ability to do less chaotic self-regulatory things like sleeping, eating. This is mind-blowing, right? We're seeing a difference. Then we saw a difference between the control and intervention group at 3, particularly around maternal mental health, because who knew if you're a better parent you'd have maternal mental health? Then at 4, then at 5, then at 6, still a difference between the intervention and control group. Not in every outcome, but still a difference. Small differences though, because it turns out a single intervention doesn't turn the intervention group into children who have got great outcomes and everyone else is languishing. Small differences, and I think this is, we talk about stacking, what's the kind of stack you need. So you'd be, both pleased and not pleased with what I'm going to tell you. So despite
Sharon,
gold standard, I'm going to stop. I'm going to stop.
Thank you.
Don't worry.
It's an exchange.
I'm going to stop.
I could listen to you all day though.
No, that's very kind of you. Probably not everyone else thinks that. Queensland have rolled it out. No other state have rolled it out.
Brilliant, thank you. Now get ready. We're going to hear from Rana, and then we're going to come to all of you. So,
Did someone drop the microphone?
so we're going to be coming to all of you very shortly. So get ready. So Rana, we're talking about prevention, and everything's okay. Everyone's okay. I saw it all, and I know the person. It's okay. Rana, we've talked about, we're talking about prevention. We've just heard, obviously, these wonderful insights into kind of investing in prevention at scale. What can you tell us about equity, right? How do we ensure that this prevention is beneficial to kind of all families, no matter what their circumstance?
Actually, Sharon's example was really helpful for me, because I'm going to continue on that and what we have learned during COVID, because it gave us a lot of insights where equity is important and why. We all remember that Melbourne got to that terrible situation with the towers, with translation and with misinformation. And the fact was, the problem came to the Department of Health in federal level. Commonwealth looked at it and they realized that they didn't talk to the different equity cohorts from the very beginning. And that's the first thing that I want to say. Whatever we do, we have to design and bring in the equity mindset from the very first step that we are taking. They learned the lesson, and I think now I can say that after 5-6 years, we are happy because they're contacting us and they're asking us questions, like with the thriving kids. They actually invited us to go and give these insights on the thriving kids design when they were taking the decision in the first step. The second thing that happened, the department created an advisory group of the experts and the peak bodies and the people who could give information around the multicultural cohorts. And it was really interesting, because they had this conversation with us, and we put diversity in the diversity. It was not just multicultural cohort. We had First Nation involved. We had people with disability peak body involved, and it was quite intersectional at some point as well. It took time, but it was built on that. And it's helped us with few things. First of all, we could bring the voice of children and young people to the conversation. So the fact that the child best interest is something that we don't navigate that much in the country is quite problematic. And when you talk about child best interest, there are lots of different definitions and understanding of that. But with us, it means that really that child should come and sit around the table with you and have a conversation with you. And we had that, and it was very interesting, because we had quite interesting kids who came to the conversation, to a round table with the first assistant secretary and minister, and they were really interestingly comfortable to say to the assistant minister that, can you please make it more simple for us when explaining things around the vaccine? And the second thing that was very interesting, and I'm glad that the secretary picked it up well, was that one of them said, "Can you please talk less? Our span of attention is just 20 seconds. Just get quiet and let us understand or talk." And it was like he picked it up immediately. But you cannot get this, and you forget it if you don't bring that child to the conversation.
Yeah.
So I guess it's really important to have this conversation, and then it gets to the co-design. And with co-design, we don't mean consultation, obviously. It's the whole cycle of the process. They need to get feedback from you. What did you do with their insight? And then at the end, they can even evaluate what we have done. They can come and tell you that we have done a good job or not. So that's the next point that we learned about it. And the two last parts that I want to say is that...
And maybe about 1 minute, sorry, because
I'm very...
Thank you. I'm going to keep doing this to you all.
On data,
Mean, isn't he?
it's just inclusion of this conversation in the data. So equity needs to have proper data collection as well. And definitely when it gets to funding or it gets to the conversation, we need that intermediary or community-based organizations to be involved as well. So it's a whole of process, whole of population process, and it's like, it's very simple for me to say because it's like a cultural thing for us. It takes the whole village. It really takes the whole village to bring in. And adding to that, considering the trauma-informed process, because there are traumas that people who are coming to the country that going through that they don't even know, but we need to consider that in the process. That I will talk about it later.
No, thank you. Look, why don't we open it up to the audience? This is going to be one of 3 rounds that we have. So online, in person again, you can not just put in questions but comments, right? We want to hear from you. This is not a panel and Q&A. We really want your ideas. This is kind of around prevention, right? So we're going to be getting into the how, but also I want to hear from people in the room as well. So what you've heard so far, what do you think? What are some of the ideas we've missed? What are some questions you might have? And I am going to pick on some people. So we have many people in the room. We could have filled the panel 3 or 4 times over with incredible experts. Anna Peters is the CEO of Vic Health. I know that you're probably going to be comfortable, and you did submit a question earlier. So we might just get some mics as well. But if there are other people, I mean, please put your hand up. We'd love to hear from other people in the room as well. And I think magically we're going to start seeing some of these comments and questions from the app as well. Is that right? Yep. And people online can do that as well. So just while we're doing all that, Anna, and the microphone will come to you. So Anna's the CEO of Vic Health, which is a really pioneering prevention agency in Victoria. One of the things you said to me earlier was kind of, how do we communicate the value of prevention to different audiences? You're obviously going through an existential issue at the moment, which you can tell people or not about. But yeah, how do we communicate the value of prevention?
Well, for those who don't know, the elephant in the room, so the government's Silver Review recommended absorption of the functions of Vic Health back into the department, so just kind of stating the elephant in the room. At the moment there's no information, so we are just continuing to function focused on what we do really well, which is prevention for Victorians. And so I guess partly in that context, but actually to the point that you're all discussing, we've been thinking a lot about how do we make the value of prevention clear to all the different stakeholders who need to be engaged for it to continue on in all its various forms. And I think you've all spoken actually to different sorts of evidence and data and arguments, and I'd love some more reflections on where you think that your argument has landed with a different stakeholder or decision maker and what was behind that, and maybe a pointed question, Sharon, like why do you think Queensland took it up and rolled it out? And I think for me, there's just that existential question, as you said, for us all to be thinking about, like what are the success cases that we've seen, and are there some kind of common narratives? So we've certainly been talking about evidence of impact at all different levels. So there's the kind of cost and health economic and, reducing ramping and ambulances. But then there's the values of stories and narratives and, people in your community. And I think those two ends of the spectrum are equally compelling, but you need to use them at different times with different stakeholders.
Yeah, thank you. I'm just going to pick on a couple of other people as well. So Suzanne, Dick, I know you're here and you wanted to say something. And I might also come to our productivity commissioners as well, so just giving you a bit of notice. And please keep going on the if other people want to speak, please put your hands up and submit issues through Q&A. Suzanne is the CEO of Prevention United. The name is very clear what you do. Any reflections from you on the conversation or other initiatives you want to briefly tell us about?
Yeah, thank you so much for the opportunity. Again, really compelling panel. Great to be talking with collaborators as well. I think there's a couple of reflections that come to mind. So at Prevention United, we work to prevent mental health conditions, and the investment in prevention of mental health conditions as compared to other conditions, cancer, cardiovascular disease, it's phenomenally low. And so when we think about the work that we're talking about in primary prevention, we can talk about co-benefits and other things, but we do need some things that are different. And some of those are investment across the lifespan. So one of the things when we're thinking about children and young people, absolutely that's a start, but it's often the neighbour who doesn't have kids, who's that mediating factor, who coaches, who's involved. And so that investment in communities is something that we're really thinking about. And my challenge and reflection as we are about to launch on a big piece of advocacy, so keep an eye out for Raising Superheroes, global film that's about to be released in relation to this, and our advocacy around 5% for prevention, which will come out mid this year, is no one argues against prevention. Everybody knows it's a good idea. Like, nobody needs more health economics. Nobody needs more pilots. What we need is sustained, systematic transformation, that it's actually our structures and systems that are making us sick. And so our challenge as we go through this work is really about talking to governments about how do we do the system transformation, not just fund more programs. And of course we need more funded programs. And so my question for our panellists is, how do we as a sector unite around that need for systemic transformation while keeping our eye on incremental change? And I'd love you all to sign up for 5% prevention. Watch our website.
Thank you. I'm going to keep going with picking on people here as well, but we're getting some really good questions coming through, and panellists, you can sort of pick and choose what you want to come to. Our productivity commissioners, I can't see where you're, Alison and Angela. You guys have just done a really amazing report on prevention. Angela, do you want to tell us a bit?
I'm not sure we have a question, because I think, look, the issues that have been raised are things that certainly came up for us during our inquiry. I think one of the reflections I would have is, why are we here? I think people in this room, obviously, and anybody who understands public policy understands the importance of prevention, that if you invest early, you can change trajectories. What is it, I guess, about this space, and what can we do about the assurance side of things so that politicians actually take these decisions going forward? And it's something we're still grappling with. There has been a lot of excitement, and thank you to people in this room. I'm sure many of you are part of those champions. Much excitement about our review and what we recommended in terms of changing that systematic change within government, about how government makes decisions, to put prevention much more at the centre of a budget process. It's kind of boring, it's bureaucratic, but it's really that cultural change piece that we were looking at, the blockages in the Australian system. That excitement has its place within parts of government. There are certainly, there are sparks of glints in the eye of public servants and senior public servants, but there's also a lot of trepidation out there, and a lot of fear that this is just, going to lead to explosions in spending, and it's not evidence-based, and it's not where we want to put our priorities. And I guess my question to the panel is, how do we get over that fear? How do we keep pushing? How do we get the momentum going so that we actually see, I guess, this momentum actually then result in the system-wide change that I think those of us in this room really want to see?
Yeah, brilliant. I'm just going to jump to one more person, and then you can come back on any that you've heard. Bernadette, I saw that your comment is down the bottom there, but do you want to articulate it? Bernadette Black, I know you're over there. You've done lots of work on Prevention Nation. There you go. Adelaide is coming to you, I think. Thanks.
Thank you very much, and thank you so much, panel. The question that I've popped up here is, as we start to see primary prevention held as a nation, and we've just released a report called Prevention Nation and a framework for primary prevention, the conditions and enablers, how do we, that will actually demand real changes in our crisis support as a system. And so how do we support that type of transformation over the coming decades? We've just heard from the Productivity Commissioners the important note about how we evaluate well, how we evaluate the impact economically as well, but also how we can transition into a prevention nation and reducing the amount that we might rely on those emergency responses. And I say this to for myself with Seed Futures, my chair and I have put I think it's a 10-year time frame that we're going to wind up. So we're, 7.5, we've got 7 years to go, 6.5 years to go. But that's something we all really have to come face to face with, and to be able to stop seeing all these reports and start to see the change and start to see us moving as society and bringing that humility into it. So I wonder what the panel might think about how to help that transformation.
Brilliant. So thank you. We've got lots of ideas. The idea today is really we're going to give you lots of information, lots of ideas. We're not going to be able to address all of them, but maybe we can go sort of pick some things you've heard that you want to respond to. Go on, Ben.
Yeah, okay, brilliant. Thank you for the amazing questions. Just a couple of points. So I met with loads of people in Victoria yesterday working child protection in early childhood and in the health sector. Hopefully some of them are in the room. And throughout all the conversations, what we saw was a really generous investment in a whole range of stuff that was compartmentalised, was not outcome-driven, not underpinned by child development, and was not in any sense front-loaded. So at some point at the beginning of the conversation, somebody said to me, what do we do about 15, 20% of people that don't respond to parenting programs? But then later on, we realised that almost nobody had parenting programs at the prenatal phase, which is when it should really start. So I think if you, I deal with this as a global issue. So if you've got all the resources being invested and everybody in the sector thinks just, make some changes to that, focus more on prevention, go more with the science of child development, and be outcome driven, and the outcome has to be that every child is safe, loved, and nurtured. That's something that's measurable at the population level. To work towards the impact as the North Star. I think that's really important. I think secondly, the vaccination example is given. So there was a massive struggle in the global north in the 40s and 50s and in the global south in the 80s and 90s when people said we need to prioritize vaccines, growth monitoring, breastfeeding promotion, and prevention of diarrheal diseases. 4 things. And everybody that worked on everything else went completely ballistic, right? And so this debate, and the reason they focused on those things is because those were the 4 things that people thought the science showed would drive the biggest impact. It doesn't mean that everything else is not important, but you sequence them and focus on them, and then what you end up with is a public health system, and a public health system where it's no longer acceptable that children will die of preventable diseases, which creates the opening for all of the other stuff as well. So sequence and focus, and this comes, I think, to the conversation about how do you make prevention attractive to politicians. When we survey communication on violence against children and maltreatment, the biggest problem is that politicians think it's insurmountable. Until very recently, we thought it was. Now we know it's not. So I think that if we go with 3 or 4 things that can be done and measured and prioritised, and get all governments around the world to work on that together, as is what happened with vaccines, then I think we could really have a massive impact on reducing child maltreatment. Those child maltreatment rates are the same all over the world, in varying degrees, but they're broadly similar to every other country and every other cultural context. Finally, there is now a WHO-led systematic review of parenting programs with 435 gold standard randomized controlled trials, which show they not only have an impact on prevention, on nurturing care, on learning and developmental outcomes, but also on parental mental health. So it becomes cyclical, and it's very interesting to talk about why. We haven't got time for that now, but that's also a very interesting story. Sorry, I went on way too long.
Rana, do you want to add some thoughts? And then Sharon will have some thoughts, and then we'll move to the next section.
Yes, I get back to last year after election. We had the Progress Australia brought together 220 leaders. You were there as well. We had the conversation on the issues, and we were all excited because we were thinking that, okay, now is the time for community and the grassroots to get to the parliament, have the advocacy, and now we want to say what. It was really interesting. You could see around the tables, we are all agreeing on the issue, but when it comes to the solution, we are not a united front. A lot of grassroots organizations right now are running after delivery of service on a surface level. They don't get to having time to think about policy, long-term policy, and prevention. That is the solution. They just want quick solutions. They don't get to that level, sophisticated level that we need, and it still doesn't happen. I think one thing is getting to the same solution, getting together, not going collectivistically, not individualistically. It's not that child should be in the center of the conversation, not our concern about the funding, not our concern about how we want to go through. I think in Victoria, we did a little bit of support, like, for example, for Vic Health. I was really glad to see the organization are talking out about that. Like, this is something we need to do. We need to be more careful of who is doing what, then get together. The second thing that I wanted to connect to this is that as a holistic approach and as what we see, for example, in settlement, we see that there is this huge disconnection in both sides. In the service provider, the education system doesn't talk to the health system. Health system doesn't talk to education system. Education system doesn't talk to employment system. They're all connected. It's the journey of a person. So we need to connect it and talk to each other and see where is what and how we can get in. It is this disconnection in the government as well. Not only the departments are not talking to each other, but also there is this disconnection, which is really amazing. I personally am always amazed that in this huge country with small population, why we have a federated model.
Which one would you get rid of?
This is a $6 million question. But that is impacting us because the federal level doesn't have that connection in the state level, especially for things that are related to children, which is the primary health and primary education. So I think these are the things that we need to navigate.
I'm going to keep moving us along, thank you. I am going to come to you, Sharon, because that's a great segue. I'm just going to call on Cliff. We're just going to segue beautifully into the second session, and I am coming to you, I promise. Cliff Everly is our policy director. He's just going to quickly run through some of the recommendations that we have been at CPD thinking about on this topic of prevention and early intervention, and then we're going to seamlessly move into... Yeah, go on.
Great, thanks, Andrew. Yeah, it wouldn't be a CPD event without some policy recommendations. So I think one of the least exciting things we can do is reform budget rules. So we've had a long-standing recommendation that reforming budget rules to track where costs and savings show up between departments and beyond forward estimates is a really important foundational element to prevention investment. It also addresses one of the comments on the screen around reduction of silos and getting governments to work across departments. Another really practical recommendation that we've seen supported by the PC as well has been around setting up avoidable cost units within treasuries. And that's really about tracking and reducing long-term expenditure through upfront prevention investment. And that is about building the public service capability to give confidence to decision makers that the investment in prevention is going to get the bang for buck that we think it will and that we know it will. And then lastly, in addition to these really important areas like health and early education, we've been talking and recommending that we expand the use of prevention frameworks to look at structural issues like poverty, income inequality, housing affordability. I mean, these are key drivers of demand for services, so areas where we can go further upstream and make a difference.
Brilliant, thank you. Thanks so much, Cliff. Ben has been a little unwell, and so he's just recovering from a cough, but he's not contagious. So we're going to move, and thank you for all those comments. We're going to harvest all those comments. I might even suggest that if we've got the names of those people, we can also get back to them with some ideas as well. So there were lots of great questions in there. So moving kind of, we've talked about, like, if we agreed trauma is widespread, that prevention and early intervention pays off. How do we do it, Sharon? So we're now coming to you with how we do it. Rana was just talking about, these siloed systems. How do we kind of connect all of these early years systems, right? So whether it's maternal and child health, disability supports, family services, into a truly universal and accessible model. How do we do that?
Well, a couple of things. What you guys don't know is there's a little timer here, and it flicked over into the next session. I could see Andrew getting more and more anxious. Just watch. I go, there's no way he's going to throw to me now. We're moving to the next session. I want to just zoom out a little bit, and I have a friend and colleague who used to work for UNICEF, and he's done a piece of work looking at the amount of spending governments do. And one of the things that's really interesting he's done is try to look at the kind of rule of thirds and basically say, which countries are spending about a third of their 0 to 18 costs in the 0 to 6 space? Just kind of a particularly around education and social care. And what's interesting is how few countries are actually spending most of their dollars in the 0 to 6 space, and in fact, how few countries are even doing 30% in the 0 to 6 space, which you kind of would think, would that be sensible, including Australia, which was down at 28%. So one of the things, and I think this is kind of where our governments come in, is like some level of accountability. Are we even spending according to where we think we should be front loading? If we want to really front load, then we need to be spending more than that 30% in the 0 to 6 space. So that's the first thing, is just we just need to be kind of recognise that another elephant in the room is if we're not spending in that space, we're probably not going to get the results we want. The second kind of cognitive dissonance moment is the intergenerational report, which was really clear that we are, number one, we are not going to live longer than the previous generations, as we always have been. Number two, chronic disease is a problem. Number three, chronic disease is totally inequally distributed in this country. And number four, it's going to cost our GDP a whole lot more in the future if we don't do anything about it. Again, when does chronic disease start? It doesn't start when you're 45. It starts when you're 4. So again, these kind of dissonance kind of conversations that we're having between what the evidence is really clear about and what we're prepared to spend about. The third thing goes to the social determinants thing, which is actually cash transfers and addressing the social determinants actually saves you crap loads of money. And that's not a kind of a, I'm not telling you anything you don't know, but again, we tend to spend much further downstream. We have a service response and we don't think about what would it take if we gave people more money. And then the fourth thing, which is actually answering your question, is because I was answering the previous one, you didn't actually think I was going to forget that.
It's a great job.
The fourth thing is, and I just also want to note that I think we're at a point in time in this country with what we have on the table with Thriving Kids, which is, I think, probably the most important and ambitious and amazing opportunity.
You want to take 30 seconds to explain what it is?
Yes, and I will.
Great.
In my career. So Thriving Kids is this kind of opportunity that's arisen through a series of maybe unfortunate events, really. So we have too many children in the National Disability Insurance Scheme, the NDIS. Why? Because for a longer conversation, but it wasn't really properly ever designed around children. And so we had a 0-1 game. You're either in the NDIS or out. And there was a recognition that it's costing us a lot of money, et cetera, et cetera. So the government said we need to get children out, particularly 0 to 9. We'll call it foundational supports, and we'll take money out of it and we'll give it back to the states. And then that sort of swirled around for a couple of years. And then Minister Butler said, actually, you know what, I'm going to take this now and we're going to call it Thriving Kids. Didn't actually consult with anyone, but that's another story. We're going to call it Thriving Kids, and lo and behold, he started to talk about universal, about prevention, and about meeting the needs of children with mild or moderate sort of developmental conditions. Against that, of course, is the results from the Australian Early Development Census. So for those of you who don't know, child development measured across the whole country every 3 years. And what we've got, children who are developmentally vulnerable on 2 or more domains, not so good, 12% across the whole country, 1 in 10 kids, 20% in disadvantaged areas. So what we've got is this major developmental kind of opportunity to make a difference. Policy momentum where we're going, hey states, please go and do something about trying to identify these children, do something, and do it by universal uplift. Do it by engaging with families and parents, and do it by thinking about how we create a proportionate universal system. Now, there's a lot of arguments, enough money, blah, 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 but there is actually this kind of momentum. And when you get this kind of, you'll all know, when you get this column policy window that opens where you've got some data that tells you something, some policy incentive, and a little bit of money, you go, holy moly, that's a policy window, let's go for it. I think it will close eventually, we all know it will, and I don't think it's going to reopen again. Well, probably not in my career time, and certainly maybe not my lifetime. So I just want to put that out as, let's not go away from this going doom and gloom. Let's go, this is a great opportunity. It's for the children that we actually really care about, and we can actually do something now in the design phase.
Yeah, brilliant. So Ben, this is kind of answering Tim Warwick's first question there, which I can see is very popular, around how do we use relationships and systems. So yeah, if we're talking about a universal early years system, how does that serve as a protective factor or as a healing factor, as Tim says, especially for children experiencing disadvantage and vulnerability?
So the greatest protective factor against maltreatment and all other forms of risk is to have a strong, secure attachment or a high-quality relationship, whatever you want to call it, with a parent. And we now know from the randomised control, the systematic review, and kind of it was always known in attachment research that you do have the capacity to improve the ability of a parent to have a great relationship with their kid. So in the maltreatment survey, the numbers are surprising, but a lot of maltreatment is unintentionally transmitted, because what is parenting primarily throughout history been automatic. And if parents have grown up experiencing neglect, emotionally barren homes, unsafe homes, they're likely to transmit it unless they have a chance to rethink and to maybe contextualize their own experience or process their own experience, or to learn the skills to form a bond. So parenting, that's what parenting programs do. And they're really, really impactful. So I think they're all about strengthening relationships. Relationships are the barrier, or the buffer against toxic stress. But I think you also need to strengthen that. In evolutionary biology, a kid is raised by 4 people, right, at least. And then our industrialized, uber-capitalistic way of life prevents that, and, for many people. So looking at ensuring that relationships in school, and particularly in preschool, are also of a high quality. Melbourne-based Professor of Education John Hattie, I think he's Melbourne-based, right? Has a massive league table based on a review of systematic reviews going all the way back to the 1940s on what drives learning outcomes. And it's the quality of the teacher relationship that drives learning outcomes. So they make sense for all of education and for all children. But for children who feel loved at home go to school to learn. But children who are unloved at home or feel unloved go to school to be loved, and they express it in the most complex of ways, as we all know. But we also know that so many people who grew up with difficult situations at home were saved by a teacher. How many people in the room can remember the name of a teacher that made a difference in their life? Put your hand up. Right? That's the power of, the legacy of a teacher never ends. So ensuring that from the age of 3, when brain development is still prolific, that children have a great secondary attachment in preschool and throughout school.
Brilliant.
Yeah.
Yeah, thank you. We're going to be coming back to you now just after we hear from Rana as well. So get ready again, comments, questions. We really want to hear it, and I'm going to be picking on people in the audience as well again, so get ready. So Rana, can we, we're talking about early years services. When they're socially inclusive, what are some of the outcomes we see from those early years services?
Well, I think it's the familiar word for all of us these days, social cohesion, the buzzword that a lot of people are using these days. And I know in 2016, we, not me, but my predecessor and my colleagues, they got together and they wrote a document, a framework for the country, which is still globally unique, and it's the National Youth Settlement Framework. I'm glad because I'm writing the National Children's Settlement Framework to add to that. And in that document, we talked about the successful outcome of a good settlement is social cohesion. And through the years, like I think even in that year, we were successful to talk to the government of the time and create the YTS, Youth Transition Support, which is specifically talking about the transition years of a child and the need and aspiration of a child to get a better settlement and settle to the country better. So we practice that. It's a successful program because it's connecting all those things that I talked about before to each other, but it's not practiced across the country. It's just with 6 states and not even 6 states, it's less. It's on East Coast and it's pilot for 10 years. That's our normal practice here, and I really hope to see something like that gets to the rest of the country. And based on that, we realized that we need to work especially on child settlement because it needs special attention. It doesn't happen when they get to the country. Usually the interview and the assessment will be with the family, mostly with the father, not with the child. So these are the things that we are picking up and we are trying to build on that. But I think it is a successful model and it's working because we considered it as an equity conversation.
Yep, so there are some great examples for us to build on, aren't there? All right, so let's do another round of kind of audience participation. So again, online in the room, please put your comments or questions into the app, or please raise your hand as well. We'd love to hear people in the room as well. Who would like to say something? Who has some thoughts on this? While you're thinking, I might pick on a few other people. Phil, you're here from the Parkville Institute, aren't you? There you are. So maybe we can get a microphone to Phil up the back there, please. And I might just pick out Catherine, great, excellent. I was going to come to you. Our minds melded. So we might just need another microphone over here, lighter for Catherine, just there, thanks. Great, thanks, Phil.
Thanks, Andrew. So question for any of the panellists who might like to offer a view. So just as context, I'm from the Parkville Institute. We're working with a number of early childhood education and care providers to implement a really intensive model of ECEC for at-risk, highly disadvantaged kids. And it's based on an RCT and delivering good results. I guess I'm thinking about the continuum from the early part of the conversation, which was about prevention, to then look at early intervention and response. And so if you're trying to put yourself in government shoes and what we would want from them over time, what's the right distribution of resource and effort from government and the multiple sectors involved in those relative parts of the work, be that prevention, early intervention and response, and how do we prompt that change in decision making, which we all know, including from my own experience in government, is tough to get that movement that you would want towards the front end. Thanks.
Thanks, Phil. Let's go to Catherine. Esther, if we can just have the mic for Deb up there as well. Catherine, yeah. It should be on, hopefully.
I think it's on.
Yep.
There we go. I think we know...
Do you want to introduce yourself as well?
Oh, sorry. Catherine Nielsen-Hewitt, Chief Children's Officer for Good Start Early Learning. I think, and also thank you for the panel for the discussion that you've brought so far, but from an attachment lens, I think we know what the conditions are necessary for forming a strong attachment and how that translates to parenting programs. So we know what kind of content is necessary, and we also know the structural conditions of effective delivery. I think the challenge sits in scalability. And if we are looking at systemic change, what does that look like at scale? And I think we've seen how that can fail at a systems level in terms of what's currently happening across our national early childhood education and care system. And so we know what quality early childhood education looks like, but we have failed children in terms of what our workforce looks like, the conditions, what we've prioritised, how we've funded both at a policy level but also at an individual level. So I'm really interested to hear from the panel, what does scalability look like and what are the conditions necessary for effective programs, preventative programs, what they look like.
Thank you, Catherine. For those that don't know, Good Start's the largest not-for-profit operator of early learning centres in Australia. Let's go to Deb, our new Children's Commissioner.
Oh my God, how profound is that? Thank you so much. Look, I've got 3 comments and you can do with them whatever you like, but the first thing I want to talk about is belonging. And Rana was really going here in her comments. At the Australian Human Rights Commission, you would be under a rock if you didn't know we've got a major issue around race in this country, and particularly for children of colour or children who are different, they do not belong. So it's great to talk about all these programs, but I want to know how we fix that, because belonging, connection's been, but belonging in this country is getting more and more difficult, but particularly for children of colour, and it's very, very disturbing. So I'm interested in how all of these programs are going to contribute to that. I also want to make a comment about income support. Yeah. During COVID, we lifted the rate of income support and saw massive change in the lives of many families. That disappeared, and those very same families went back into poverty. So what went wrong there? And my colleague over here, John Tobin, who isn't talking about children's rights because he's sitting there thinking about it the whole time, they're not prominent in this conversation. And I have to say, children have rights in this country, but they're not exercised. I'm not sure how many government contracts of those in this room have children's rights as a requirement of the providers that are delivering services to children. I suspect not many. So these are just comments, but I think that to give this meaning, I think we've got to have some more fundamentals in the conversation about rights, about income support, and about belonging, because these are the things that really matter to children. And the last thing I'll say is children say to me, why can't you give me a service alongside my family? They're suffering. I'm suffering. We both need something. Can't you deliver that for us together? So thank you.
Yeah, thanks, Deb. You're going to be a fantastic National Children's Commissioner. We do have heaps of other people in the room who I could call on, including the people who are working for the Victorian Government on early learning. So this is great for everyone to be involved in the conversation. I didn't let you have a go last time. Do you want to come in first on kind of all these different various comments and also some of these things here if you want, up to you. And again, I'm sorry we're not getting into everything, but we will harvest all the comments, so we're not ignoring them. We will definitely take them on board.
Yeah, and I might riff off both Deb and Catherine. I think we can be sometimes overwhelmed by the sense of how do we sort of move forward. It's not terribly difficult to do a single program. It's pretty hard to think about how do you do system change well. So I just might reflect on some of the stuff we've been doing. We've got this thing called restacking the odds, which it's not so much the story of that, but we kind of said, what if we could just get 5 things right for kids? Just 5 things. And we used James Heckman's idea of this idea of dynamic complementarity. And you probably know him because of the other stuff he does around early childhood. But he's also published a fair bit about human capital. And this idea of dynamic complementarity is how do we actually build kind of mutual benefit on the system? So it's not like, you know how it is now, you go to some decent antenatal care, then it's pretty crappy early childhood care, and maybe a bit of this and a bit of that. So there's no kind of building on the next part of the system that's building all the things you've talked about, relationships, just... And so we said, what if you get 5 things right based on 3 kind of bottom line things? Is there enough of it? Is it any good? And do people come? Which seems kind of fairly obvious at a very base level, and turns out it's really hard to get the data. Most people don't use the data, despite our multi-billion-dollar investment in services. I can't even imagine running a business the way we run our services without data. So you can't get the data. Most people don't know how to use the data, and it's very hard to actually move the system. So I think your point is well taken around scale. However, you can. And I think at some stage we have to sort of start experimenting really seriously. And you've put in what you think is in the kind of pack of the stack. The stacks are all very similar, and at some stage we need to give it a go. We put in this proposal to Lego, and we keep calling it the Lego proposal, which we didn't
Lego
get.
Foundation.
The Lego Foundation. We didn't get the money, but I got probably the best reviews ever. Anyway, the idea was, what if we could just build something, what if we could just get 5 or 6 or things really right and actually truly build a community around it? And I think we have to do this kind of two-speed thing. What sort of policies do we need that can enable the sorts of things that we want? And then how do we just go about building it? And I know, like Benella's here, there's probably other communities that are here. They're just trying to give it a big go, but it's really hard without actually having some enabling environments in there. So I think, I go back to thriving kids again, just because I think the moment is now. So if you've got these ideas and you kind of really want to do something, now is the time, because we'll scale by doing local out, not by doing everything everywhere all at once, because I think that fails.
Well, that's a nice segue, Ben.
Everything everywhere all at once.
and scalability of relations. I know they're 2 big concepts for you.
Yeah, so I think one of the problems with progressive change is, and Ezra Klein has talked about this in Abundance, which I know a lot of people have read, the progressive ideas break down because you have this everything bagel, this everything everywhere all at once approach where people cludge together multiple outcomes. So what you've got to do is focus and sequence and say, what are the 3 things we want to scale up right now that the science tells us, that the science tells us will have the biggest impact on prevention and promoting and nurturing care. These are 2 sides of the same coin. And B, that have cross-constituency appeal, right? Because a lot of this stuff we're all the converted in the room, but we need to reach out to other parts of society and get buy-in across the spectrum to make that work. A couple of the other things that came up. The human rights question. Everything I talk about is human rights. I'm a human rights professional. So my view from a human rights perspective is that now we know more about the science of how violence and maltreatment are transmitted across generations. We have a human rights imperative, and the government is the duty bearer to use that science to address the issue, to fulfill, protect, and promote the rights of children. So I don't use human rights language so much because I don't always think that's the best way to talk about this if you want to drive people towards change, but it is very much a human rights issue. In distribution, I think you need to have a framework of progressive, universal progressive, that's got the flexibility. The feedback I got from all of the people in the sector in Victoria yesterday was that everything's boxed in, right? So you have to have an agile, universal progressive system that is based on working towards outcomes and informed by child development science. I think scalability has already been answered a little bit, but I answered it as well by having that focus on 3 areas, and they can be scaled up. Things like parenting programs, there's schools, relationships, and so on.
Yeah, brilliant. Thank you. So I'm going to call on Kate Tawney. I don't know where Kate is exactly, but there you are. Kate is one of Australia's finalist journalists to the CEO of the Peter Mac Foundation, many other things. And Kate has been a partner in crime with me in thinking about how we can make this event more innovative and more participatory. How are we going, Kate?
It's been fantastic, and fantastic to hear so many voices and so many extraordinary voices. I am probably the least qualified person in this room in this particular subject. But no, I think the interaction has been really terrific. I think the question that I have for the panel, it's been beautiful to listen to. I think, Rana, you were talking about it takes a village, absolutely. And Ben, you're talking about, children needing those significant adults in their life beyond their parents, and then the theme of belonging too, which I think is really important. In my job, I get to spend some time in Denmark every year. And last year, my 19-year-old son joined me for a while. And I have got used to the Denmark culture of it takes a village. And so when you are sitting outside a cafe and there are 6 prams, and a baby cries and there's no parents, you just rock that pram, and that's what you do. So my 19-year-old son was sitting with me outside a cafe. There was a children's clothes pop-up and about 15 prams outside, and a group of boys his age, maybe 10 boys his age, were walking along the street, and they stopped and each one of them rocked a different pram. He was sitting there saying, what are they doing? And I explained, well, that's what you do. And like that culture, so that sense of responsibility. Every morning when I walk to work, there is the children's walking train, which is led by a grade 6 child. They have to apply, and it's the best thing that can happen. They don't want to be primary school captain. They want to be walking bus captains. So that goes to the heart of, from the outset, that sense of responsibility and accountability. And yeah, I'm interested to hear how you embed that in those strategies and programs. And yeah.
Yeah, thank you, Kate. We're just going to round out this little session on kind of services with a little bit more of CPD's thinking on this as well. So Kat Oborn is our Social Services Policy Director, a real expert in this area. So thanks, Kat. Oh yeah, sorry, you need a microphone. Thanks, Esther.
Excellent, thank you. So it's been great when thinking about, so I really loved the sort of percentage, Sharon, that you were talking about. And so a lot of the work that CPD does around the early years is really trying to boost that investment that we're making in those first sort of 6 years of a children and family's life. And drawing on the theme of investing in sort of 2-3 things. So we talk a lot about sort of 3 pillars that we think of an integrated, progressively universal early years system here in Australia would have. And so you have access to 12 months of paid parental leave so that you can spend time with your children. And that's spread across mum and dad, so across both partners are able to access that. That you've got access to really high quality universal early childhood education and care that includes access to preschool. So going to Catherine, who's working at Good Start, so really with that emphasis on that high quality engagement. And also that families have access to, again, equitable, high-quality health services from pregnancy, so from when they're supported through pregnancy to giving birth to coming home and being supported by maternal and child health or the family and child health nurses. And so we think about that, and I think, again, Ben was touching on this, of thinking about this as a progressively universal approach. And so, again, Sharon, you've spoken about this, that this is providing services for families to the scale that they need, when they need it and how they need it. And so it really is thinking about these as those pillars that all children and families can receive through those early years.
Amazing, thanks, Kat. All right, so we've kind of looked at prevention, we've looked at universal systems, we've solved everything, haven't we? But we're just going to move now to how do we make sure that these service systems are shaped by communities, so into kind of people and place. Because obviously none of this really matters if people don't trust the systems that are meant to support them. So we've got a poll here, so if you all whip out your phones, I don't know if you need to whip out your phones, but if you're online, anyway, in the Slido page, we want you to say, where have you experienced a service or support that prioritised relationships and built trust, particularly for families and children, and how did it feel? People, is this working for people on their, yes? So you need to tap away. This is a free text field. So if you just write your answer, this is your homework. We want to harvest these examples where you've seen it, where it's worked, how it's made you feel. I'll just give you a minute or so on that. And so, so I guess what we've been talking about here is like, and we've had lots of questions on this, and it goes to the heart of trauma proof and to the heart of Rana's work as well, is what would it take to build these systems that prioritise relationships and build trust? Because often, we know these systems are kind of punitive and compliance driven, places of punishment, not healing, as you say in your book, Ben. So some of these answers are coming up now. We might just let them scroll up, and we'll be able to read some of them, but we'll harvest all of them at the back end. So we can see here, kindergarten, couldn't agree more about that. Shout out to our wonderful St Kilda and Balaclava kindergarten. Mothers groups, maternal health care programs, community sport, midwife mothers groups, primary school. I mean, primary school builds such a fantastic sense of community. Maternal and child health, health services for newborns. Anyway, we're not going to read them all, but you can see them all flashing up. Hey, Rana, let's turn to you. So these examples, right? Did I miss something? From my dog. Thank you, Paul. These answers are all profound on various levels, aren't they? So on this exact topic, like how do we ensure that kind of service design works for culturally and linguistically diverse families and communities? Love to hear from you.
Well, we do a lot of service design, and the most exciting ones were the ones that we had the children and youth focus groups. So with the conversation with them, you have to break a complex issue to smaller parts and have this conversation. And at some point, we had something called a serious logo workshop. So actually, you have to go and get training how to do that. And we had a facilitator who was trained, and she had this package of logos. She opened it, and we designed something together, adults and children and young people. So this is how we are talking about co-design and bringing them from the very beginning. But I agree with Deb and Ben on the child right as well, and the general principle and foundation of the work. So we put principles in the beginning, and it actually can match to any scalable and place-based work when you have the principle as a foundation. The principles we usually have are the child rights, which is a child best interest, Article 12. They have to be participating. They have the right to participate. Then we go through the trauma-informed. And trauma-informed is not just about healing. We are not counselors, but we need to consider that that person in front of us can have traumas. And it's really interesting because recently with the 12-day war or this war, I just realized that I have some childhood trauma from the 8 years Iraq-Iran war because I was in there, and I have a very sensitive reaction to the siren sound. And now we are going to have this siren sound going around the country, and that was our conversation and feedback to the National Emergency report that be careful with this siren noise that is traumatizing. So these are the considerations, trauma-informed, and then it is talking about intersectional. We have to talk about, like, if you're talking about culturally and linguistically diverse groups, you have to consider their faith, their family setting, where they're coming from, and their gender identity, how they describe themselves, and all of these aspects, disability aspects. All of this should be included in the equity. It's very sophisticated process, but if these are the foundation, then you can get to the place-based and scalable situation. Something like transport can be one topic, transport, but it's very different in each state and territory. And when you talk to them, if you consider this, you design it, then you scale it and make it place-based. It's not a whole of population conversation. It needs to be disaggregated in a specific way.
Yeah, great, thank you. Sharon, when we sort of talk about tailored services that respond to the needs of communities, what does that look like in practice for those service delivery organisations?
I really want to reinforce this idea of relational practice and the fact that relationships are at the base. Well, they're actually the basis of everything, aren't they? I mean, nobody here needs to be convinced of that. But we do need to think about how that works. And that's why that Sustained Nurse Home Visiting program works so well, because it was about building relational practice. And if you look at some of the work that's happening in communities, a lot of the stuff that gets accelerated is because they've got people in the community who are building those relationships and are doing so. And I think the challenge for us is how we start doing that at some level of speed. And I think one of the challenges I want to put forward is how do we build relationships and do it at some level of speed? Because I don't think as a country we can afford to go slowly. So we always talk about going at the speed of trust, and that's all about building relationships. And my challenge back to everyone here is how do we speed up the speed of trust? How do we use kind of some modern technologies to be able to build relationships either online, through other sorts of ways? Because I feel that if we don't have those relationships in place, if you don't have the voices of the people around you helping you know what to do, then you kind of end up in the wrong place. But nor can we do that for the next 5 years while we work out what to do. So I think we're at this kind of pivotal point of time, I should say, where we've got these modern technologies, the ability to speed up the speed of trust, the fundamental understanding of using relationship-based practice, and the ability to experiment and to also experiment at speed. And so I don't want to sit here and go, oh, thank goodness I'm here, I've got all the answers. But out there, they do. What we don't do very well is give people the ability to experiment with the data they need and the authorising environment, and we don't join up experimentation. But we could, and to build on everyone's points here, we could bring all of that to bear. We could work out what are the 3 or 4 things we want to really do well, and do it really well. And if you think that that's overwhelming, just remember, Australia as a country just came, I don't know, what was it, 14th in the Winter Olympics. We've only got like 3 mountains. 14th in the Winter Olympics. We came 4th in this, like we're a pissy country of 26 million people. 4th. So I always think that, whenever you think, no, we can't do this, well, it turns out we can actually do this with the right political will and the right resourcing. So I just kind of want to put it out there that I think we absolutely can and we should.
Building on what Sharon said, on the trust and relationships, we are seeing a lot of practice of warm referrals. I think everybody these days are trying to do the warm referrals. And it's a good practice, but it's not systematic. It's random, it's relational, it's incidental. My view is with the sensitivity about data breaches and all of these things, that we cannot put a centralized database for things. We used warm referrals, but we don't use it to the best. We need to make it systematic. We need to set a directory in a setting, in an organization, in a system, have these relations very much on the ground, like I have relationship with Vic Health. I know that, and I write it down and I deliver it to the next person, so they know that they can do warm referrals to the Vic Health. This doesn't exist and doesn't happen, and I think this is one of the most important things on building trust and using the relationship that exists.
Yeah, brilliant. Thank you. Let's go back to all of you. Really want to hear on kind of people and place approaches, local approaches. So again, please put some comments into the Slido or really put up your hand. We'd love to hear from people. So we've got Trav and Matt. I was going to come to you anyway, Matt, so that's great. If we can get 2 microphones over here for Trav and Matt, that'd be great. Esther, you know Trav, and then Matt at the back. Anyone else who want? Yes, great. Let's go to Matt first.
Matt, you go on first.
As well at some point.
Yeah. Well,
thanks, Trav. Firstly, Andrew, thanks for convening the conversation, and to you, Ben, Rana, Sharon, thanks for your contributions this evening. I guess my question orientates around men and the reality that, overwhelmingly men are responsible for child maltreatment.
That's not statistically correct. I think that's wrong, but sorry.
These guys met this morning, had breakfast together, so it's okay.
So we really like each other, but I think for sexual violence, I think you're completely right. But everything else, I don't think the data reflects that.
So the Australian child maltreatment study is pretty clear on physical violence.
Yes.
On sexual violence, and then agree on neglect. Put that in a separate category. And so at the more severe end of the spectrum, the evidence, in my view, is clear that men are overwhelmingly responsible for that behaviour. And certainly you can argue about maltreatment as a whole, but there are really severe forms of violence and abuse when men are responsible for the behaviour. And so I guess my question is, what does that imply for prevention efforts, particularly with boys? Like, I'm mindful that, not deterministic, but there is a relationship between victimisation and subsequent perpetration. And so I'm curious as to what that implies in terms of where we put our efforts around prevention, and also, to your question, Andrew, around trust, how we promote help seeking amongst men.
Yeah, great. Well, I'll definitely get you into this conversation. I know you feel passionately about it. Let's go to Trav, and then we'll go down here, and then we'll go to Ben.
Cool. Thanks, everyone. So 3 things maybe to connect the place and the local connections with some of the system points. So the first on nurses and nurse visits. So the name of our maternal and child health nurse was Bernadette, and it was Tuesdays with Bernie. And it was brilliant for all the reasons that have been cited. But as Sharon knows, there is a huge variance across the country with what is guaranteed in terms of maternal and child health visits. It's an extraordinary range that CPD has collected. So the first comment is we can't sustain the local to system connection and those warm referrals and trusted connections between parents and the system unless there's some baseline standard of maternal and child health visits. So Sharon, the one to you is, where does that go? Where do you think the minimum is in terms of the national baseline? Second one is on that third bucket of families and parenting programs. So everything that connects the home environment and natural settings into playgroups, parents groups, hubs and the like, goes to the funding point made before. So the budget allocation for families and children's activity has actually declined in real terms over the last decade. So to your point about investment, we need to be really careful that the push for a universal system, which we all believe in, particularly a strong ECEC, early learning system, doesn't crowd out the broader ECD objectives, particularly the connection into the non-early learning parts of that integrated service system. And then the third is Thriving Kids, right? So it is a prevention program, really, and there are some wonderful trials of what it might look like. But I'd love the panel to think about, what does the practice model of Thriving Kids look like in natural settings as well as the more sort of targeted supports?
Thanks, Trav. And then just this gentleman down the front. I'm sorry, I don't know your name. There he comes. There he comes. Yep.
Thanks for that. I guess speaking to Sharon's point of new spaces where people are congregating, I guess what would your appraisal be of the digital and ether space? What role the social media ban that's held? Your appraisal sort of that, and can we be doing more to be reducing polarization, hate, and division that exists in these online spaces that are becoming increasingly charged?
Thank you. Ben, shall we go to you first?
Yeah, firstly, I wanted to respond to the earlier question about about how do we support the conditions for take-up, and how do we put relations central. One of my favorite stories is Bernadette's story in the opening of the Prevention Nation report that everybody should read, and it's about Wendy and how much, as a teenager, Wendy helped you to find a way forward in a very difficult context, and everybody should read that. It's a wonderful story. Everybody needs a Wendy, right? I think that all of this shouldn't happen in a vacuum. We need to make people as aware of the A, B's and C's of child development, child protection and risk, adolescent brain development and early childhood development, as people know about stubbed toes and ear infections and COVID. We need to make that understood. We also need to remove judgment and shame from the conversation. Like I kind of came to a point in my own journey where I simply started saying, of course I've got, I'm from a children's home, of course I've got trauma, it's not a big deal, I work on it, to take that, to kind of release a valve. Like you look through history, the conversation, things that used to be taboo, domestic violence, menstruation, other areas, and we've released a valve by opening up that conversation. I think that's really important. Globally, on the issue of gender and maltreatment, we're redefining maltreatment in a very, very broad way, right? To understand emotional neglect, emotional abuse, all kinds of physical abuse, sexual abuse, and witnessing things like domestic violence and dysfunctional parenting as well. And globally, the data shows that there is not an overwhelmingly male. We don't talk in terms of perpetrator and victim in most of those areas because it's unintentional, automatic transmission. But we don't, I think in terms of sexual violence and to some extent physical violence, there are some studies that have a higher level, much higher level, well, sexual violence overwhelmingly male. But I think across the board, there is a high proportion of maltreatment that comes from a relationship with a mother or an older sister. It's very, very common. The reason that I responded to it was because when I started this conversation 10 years ago, I did a TED talk. And I used the example, I told the story of a girl that was a victim of violence. I talked about the data on girls affected by violence, and 1 in 3 girls globally affected by violence. Half of them never talk about it, and all of that. And I got inundated with messages, firstly from boys who've been victims of violence, and people that have been victims of neglect or violence at the hands of the mother. And when you speak about this issue, if you say this group is affected or that group is the perpetrator, and people can't find themselves in that narrative, you shut them down. So to me, I'm always mindful of Zadie Smith, the writer, says that at the level of the sentence, she wants everybody to find themselves. So that's why when you said it, and I really appreciate, we're collaborating, we appreciate your work, but that's why I felt I needed to respond. And when I saw it on there, I wanted to respond as well. So that's why I think we just need to consider that a little bit. I hope that's clear. I hope we're still friends.
Thank you, Ben. Rana and Sharon.
I start from the last one. Young boys and men are a point of concern for us, not for being the perpetrator in general, because of the data and statistic on the level of disengagement from school, the specific impact of what's happening to them when they are traumatized. They don't speak about it, and it's very different. And because family violence and gender inequality is a huge topic in the country for the last few years, we focused dramatically on women and finding solution for that without bringing men, especially young boys and men, to the conversation. it's becoming a very female-dominant space that men are not participating because it's not about that. And it's very interesting because the connection between that and what we experience in the multicultural space is that whenever we want to talk about racism, you sit in front of a group of people who are multicultural and you're talking about the same topic and their experience. You don't talk to the person who actually is racist. That's the conversation right now. Because we're close to the International Women's Day, I share this example. Since 3 years ago, I don't go to talk to any International Women's Day because I just sit and I just see all the women in the room. There's no man, and sometimes some of my friends say we should pat on each other's shoulder and say thank you to ourselves and have our own day. But where are the men to say thank you? This is the missing part. And I think we need that conversation to how to bring men. There are programs like peer support and people with lived experience that actually need lived expertise as well. But we cannot separate people from each other. We have to have that conversation with everybody and bring them. And that gets to the equity and the diversity. That's when you have a room full of different people, even if it's the diversity of mindset, you get to a solution. But if you just go talking about men without men right now, or talking about women and without men, or children without children, you don't get to that level of solution.
Yep, we're definitely delving into some juicy issues here. Thank you. Sharon, this is kind of your last word.
Sorry, I thought I'd end. I've been reflecting on what I could say that might be useful in this. Like everyone's said such amazing things. I thought I'd reflect on what happened in the UK in the late 90s, I guess, when Blair announced Sure Start, and I think it's worth just thinking about that. So basically that was a multi-million pound investment in early childhood. And in particular in these ideas of Sure Start centres. And what were they really? They were kind of really trying to work out how do we actually bring families together around an actual physical, we could talk about whether it needs to still be physical, but it was aimed to try and bring families together so they could be together and have their needs met, co-designed, all the rest of it. And a very wonderful woman, Naomi Eisenstadt, actually was the leader of that from a policy point of view. And she gives this great story about everyone was all a bit, worried about this, experiment where local people were getting all this money and they were doing things with it. Everyone was very nervous about it. And then they found out that in one of these centres, they were running aromatherapy classes. And somebody local went, oh my God, they're running aromatherapy classes. There's no evidence for that. And she said, no, that's the point. You run the aromatherapy classes because that's what the families want. They come in and then you can do the parenting programs and all the rest of it. And then Sure Start, as you know, the Tories came in and it was the end of Sure Start. What's interesting is, and I think we should take hold of this sort of stuff, because you do need this two-speed stuff, exactly what Trav was talking about. How do you do things at a whole of system, but also how do you do things locally and learn? So Sure Start now has had an evaluation, a meta-evaluation by the Institute of Fiscal Studies, and it turns out that, children who are living in areas that were close to Sure Start centres had better education outcomes, less likely to go into justice, better health outcomes. So now they're trying to reconstitute it. But what's more important is when the government committed to doing something about young children, infant mortality rates went down for poorer people. And since that's all gone away, infant mortality rates have gone up. So children actually die when we don't actually focus on this sort of stuff. And I thought of put that at the end because it just goes to show you that when you have this convergence of substantial money on the table, an ability to allow for local sort of innovation, but with national guardrails and the ability to scale, and something that says we're going to do something systematically across the whole country, you actually can make a difference. And I guess the question for us, are we there at the moment? I don't know, but we should feel like it's all possible, and certainly possible in a country that's one of the 15 richest countries in the world with a population of just 26 million people.
Thank you, Sharon.
That's my last word.
So we are going to rapidly move to a wrap-up here. Before we do, we're going to go back to our original poll. And you can see these are just some recommendations from CPD that I won't dwell on, but we've been doing a lot of work in this space as well. Back to our original poll. Let's see if the numbers have changed. So it's that same original poll in 10 years' time. This is kind of our future casting question.
It's so unfair, though.
It is unfair, isn't it?
It's like
it
the
is
antithesis
unfair.
of what we're suggesting.
It is. We've debated about this internally a lot, but we're getting people to participate, and we'll see if these numbers change. While you're voting away on that, I'll give you 10 seconds. So we're going to have a wrap up from CPD's board chair, Zoe Witten. Zoe is a fantastic leader in the corporate finance space, has worked at Pollination, Credit Suisse, Bank of America, many others. One of her superpowers is that she can summarise a very rich and diverse conversation, even if it's a topic that she's not an expert in, with a fantastic wrap-up. She's also on the board of the Net Zero Economy Authority and many other things. And like me, was a youth delegate to the UN. I'm not sure that we've ever really dwelled on that similarity, Zoe. Yes, let's have a quick look at this. I think, can we see all of them? Zoe, do you want to come and take a seat? Yeah. The last one's winning even more. Yeah. No, Zoe, come sit up here, please.
Yeah,
you move the gum leaves.
I'm coming.
Great.
I'm going to hang out with the gun leaves here. Give them to me. I'll put them in my lap.
Yeah, I think you should have one because that was clearly the instruction. I'll take
I've been
one.
looking
and
forward
pass
to
it on.
that
There you
gun
go.
leaf since the beginning. Thank you, everyone, for joining us for this conversation. We do the Policy Exchange. Many of you know us well, and you know that we have done a yearly or bi-yearly conversation on some big transformative issues for a while now. And I'm looking at Trav, because he used to be responsible for making this work, and now Andrew and the full team of CPD brings this together. And one of the things we realised along the way of having these conversations is that this is always more than a speech. So we used to have a speech, and then we would have about 100 meetings in the background of the speech. And we thought about it, and we thought, actually, you need a conversation and a community like this to make transformative change happen. And if it's not clear, that means that all of you are part of that community and that conversation, and many of you have been for a long time, so thank you for that. In this context, you can see why we brought Ben. This topic is a personal topic. I had my life saved by a teacher as well, whose name is Lee, but it's also systematic, strangely systematic. And when we started talking about this as a CPD team, we all kind of went, there was this kind of, but it touches on my policy area, but it also touches on my policy area, but it touches on my policy area. And so we could see this broad-ranging transformative message here. And Ben talks in the book, and has talked a little bit today, about this being a revolution that is at the size of the child mortality revolution. And we certainly see it that way. It's not a small problem. It is a transformative idea that puts a broad lens across all of our policy areas, and many of you know them very well. But you could say that at the end of the day, many of our policy areas are focused on transformative ideas that help keep our social fabric together, help weave it, help keep it healthy. We didn't get to the question about vulnerability and reactivity in social media, but we were getting there, because these are all questions of how we keep this system together and how we help everyone feel like they belong in it and it has something for them and they can see themselves in every sentence. We've talked a lot tonight about how we get take up for a policy that everyone knows works. So how do we get that through? And Andrew is right to say that everyone in this room is more of an expert on this than I am. Everyone. So I'm citing from your ideas and I'm never going to get the depth of them. But how we get the shift in paradigm to avoidable cost rather than a fear of investment, how we get rid of that proximate fear of putting enough money in at the beginning to get the results that we need across the whole system. Our emeritus board member, Tom Gold, couldn't be with us tonight because he's been struck down with the lurgy that is stalking many of us. But he sent a question in, which was, what if prevention and care could be considered nation-building infrastructure, like defence, like transport? Tom's always really good at taking an idea and transforming it to its core. He's an economist, so he sees things at that level. And that struck me because that's the transformation we're looking for here. And so I'm going to take my chair's privilege, and I'm just going to say that one of my favourite points about Ben's work is the point, actually, there are many favourites, but one of my favourite points is about focus. And Ben, you talked about this towards the end of your comments. Apocryphally, Obama had a comment about, you know, nation's in trouble when you get to the 90 days paradigm, which is when you can only deal with stuff that's going to end the nation in the next 90 days. And I was listening to what you were saying, Rana, about the reactivity of the current system and thinking, if the population statistics are to be believed, and they are, the whole system is in 90-day territory now. We're dealing with the outcome of not having provided the system and the care at the beginning. And we're dealing with it across our whole system. 10% of GDP is not a small number, and it's a number that we are missing. So when, Ben, you talk about focus and bringing all the different people who work in this system together to say, what are the core interventions that we can all get behind that become a transformative program that is a revolution, that really strikes me. So CPD always does its best work building coalitions and building conversations and bringing everyone together. We have been working, and we will keep working, on this transformation to avoidable cost and to prevention as long as we need to, I think. And as Sharon says, we'll do that because there's crap loads of money that we could save, but also to keep us out of 90 days and to make Australia an example and continue to make Australia an example of the best place to raise a child, to be a parent, and to live. We can actually do it, just like we can come 14th at the Winter Olympics. It's important now, as it is ever. You know, it feels like the world's falling apart a bit. Got to keep working on it, it's the time. So thank you all for coming. And please stay part of the conversation with us. Stay in it. Thank you very much.
Brilliant, thank you. So that's it, thank you. If we could all just, please express our thanks, especially to Ben, who's come all the way from New York. Please come and have a chat with other people. Please come and have a chat with the panel afterwards. We really appreciate that. But thank you for coming out.
Thank you.
Please do, if you haven't got a gum leaf, please do grab a gum leaf. It was a really generous gesture from Uncle Colin. There's a lot going past. It's also Chinese Lunar New Year is wrapping up tonight, and there is a lunar eclipse happening tonight. So if you didn't know about that, if the clouds have parted on your way out, you might be able to see a really rare and beautiful blood moon and lunar eclipse. Thanks everyone for coming. Really appreciate it. Thank you. Thanks guys.
Well done to you as well. Brilliant moderation.
Thank you.